Hello, my name is Sam Downing. I'm a family physician here in Prescott and currently a board member for Northland Cares.
Hi, my name's Dr. Carol Galper, and I'm a board member with Northland Cares.
Hello, my name is Hedda Fay. I'm the Community Outreach and Program Manager for Northland Cares.
My name is Cheryl Motz-DeCamp, and I'm Medical Case Manager.
Kevin Kieran, Chairman of the Board of Northland Cares here in Prescott, Arizona.
My name is Johnny Martinez. I am the lead medical case manager at Northland Cares Cottonwood office.
My name is Jody Vickers. I'm the medical receptionist here at Northland Cares.
My name is David Kekich. I'm a physician and the medical director here at Northland Cares.
I am Vonda Chisholm, the executive director of Northland Cares.
I appreciate the opportunity to be a part of this presentation because the history of HIV in northern Arizona is really pretty interesting. And it really was a grassroots effort, and it came from a group of, originally a group of parents who were parents of individuals who were gay, and many of whom had either contracted HIV themselves. Some of them had died from AIDS. This was in the mid to late 80s. And it was a group that came together to really support each other originally. And then out of that morphed some county health support as well for HIV services. And when we recognized that northern Arizona was deficient for providing HIV services, that's when we really moved toward developing a clinic specifically for HIV that would be self-supporting and not-for-profit agency that could provide those services. And that's when Northland Cares got started.
I'd have to say the biggest progress that I've seen is the treatment available. You know, now I can say to somebody who has HIV that in order to stay healthy for them is obviously get on their medications, what suppresses their virus, and then sleep, eat well, exercise, and take care of yourself.
Northland Cares, there's so many people that come in there to get tested, to get condoms, to get PrEP, and then those that have HIV or had HIV. I've had several people come in and just say, I feel safe here, I feel welcomed here. I love coming here, you guys are awesome, and you're like I've heard a couple say you are like my family.
In the time that I've been doing this, and I started in 2011 with my infectious diseases training. So that's the first time I really was, heavily into HIV medicine. I've just seen things get progressively easier, progressively less side effects, less pills, better outcomes. Most of my patients now take 1 pill a day. Most of them say they have no side effects, and everybody's doing really well. So in the time that I've been doing this, I've just watched HIV treatment get progressively better and easier and more tolerable.
I had just resigned a couple months prior from being a director at a school, and I was looking for another position and found out about Northland Cares from an acquaintance. And when I found out what Northland Cares did, I got very excited because I had volunteered with an agency called AIDS Interfaith in the 90s, and that was still when AIDS was a death sentence, and I had not realized how much I hadn't realized how much progress had been made in the HIV/AIDS industry. So I called them up and said, you have a couple of positions. I'm your gal. I don't care which position you put me in, but I belong there. And so I interviewed and got the medical case manager position, and that's how I started here. I would say in the last year we've made a lot of changes, but one of the challenges that we've had is that the Prescott area and Yavapai County did not know we existed. And we're trying to change that.
I would say the biggest challenge, quite frankly, was stigma. We're in a small, rural, conservative community, and the idea that we would be providing services to individuals who were stigmatized from the very beginning, quite frankly. When I was in medical school, I was introduced to a concept called GRIDS. Before it was AIDS, it was GRIDS, G-R-I-D-S, which at that time was defined as gay-related immunodeficiency syndrome. And so early on, the association with sexual preference was almost the thing that ruined appropriate treatment for HIV, because people made assumptions right off the bat. And so getting through that stigma in a small conservative community was probably the biggest thing. And then resources, finding the resources to provide those services and care and expand those services over time.
Our clients here at Northland Cares definitely face a lot of ignorance and medical discrimination. We've seen people be turned away from doctors' offices still just for the fact that they have HIV. We've seen people, that lose relationships with family, with friends.
I think that one of the things that's really important to know is what an amazing resource Northland Cares is for Northern Arizona. The organization is full of compassionate, caring people who are non-judgmental. The organization is made up of a board of directors who have the same values, who want to see people get the preventive measures that they need, who understand that there may have been judgment in someone's life about HIV, and that has no place at Northland Cares. Northland Cares is a welcoming, professional organization with the absolute most up-to-date healthcare provided. And I think we're lucky. We're lucky that it exists.
So if you're out there and you're concerned that you may be HIV positive or may have had an exposure to HIV and are concerned about getting a test, I would encourage you to come in and be tested. Whether you're positive or not isn't going to change when you come in for a test, but what will change is if you are HIV positive, we will be able to immediately start you with care with our fast track to HIV and provide you wraparound services, medical case management. Our providers are infectious disease specialists, so you'll receive the highest level of care. They can also be your primary care physician, which helps if you have any other health conditions. And people with HIV live a long time. In fact, June, we celebrate our long-term survivors month. We have a celebration for them because you can live longer with HIV than you could with other conditions like high blood pressure, type 2 diabetes. It's not a death sentence today.
Northland Cares is that safe space where they can come here anytime, every day of the week, and tell us what they need. It doesn't have to be a clinic day. It could just be they need help gearing up for a new job, or they need help with food or rent, or just some people to talk to. We are the safe place.
We are the entity that does all the housing for HIV clients in need for all of Northern Arizona. We don't have enough money to cover all of that. We are looking for a way to get a home or homes that we can place homeless clients in. There are restrictions to how much money we can give people for food. Some people are too sick to work or on disability. In our area, rent is too high, food is high, gas is high, everything's going up. People are barely making it with the amount of food assistance we could give people. People can't even buy groceries for a week. So once we are able to move, we want a food closet. So I would say that building our donor base for our nonprofit area for things that we don't have funds for is next in line once we get to a place where we can actually spread our wings and do the things that we are prepared to do once we get the space.